Mr. Pitts.
Thank you, Mr. Chairman. Under the proposed legislation, virtually every individual will be required to have health care that meets minimum benefit standards. The bill does not define these minimum benefit standards, but instead establishes a new government health board called the Health Benefits Advisory Committee. This committee, chaired by the Surgeon General and in concert with the Secretary of Health and Human Services, will issue binding decrees on what is or is not considered a minimum federal benefit standard. There is no doubt that this process will result in mandated coverage of abortion, along with federal subsidies for such coverage, unless Congress explicitly excludes abortion. When talking about health care reform, President Obama himself stated that, quote, reproductive care is essential care, basic care, end quote. Secretary Clinton just recently clarified that, quote, reproductive health includes access to abortion, end quote. History has demonstrated that unless abortion is explicitly excluded, administrative agencies and the courts will mandate it. We've seen this time and time again. The federal Medicaid statute was silent on the issue of abortion, but the administration and the courts deemed abortion on demand to be mandated coverage, and it ended up funding 300,000 abortions per year with tax dollars. Then in 1979, Congressman Henry Hyde asked the Indian Health Service where they found the authority to pay for abortions. They responded, quote, we would have no basis for refusing to pay for abortions, end quote. In both of these cases, explicit exclusions had to be added to ensure that taxpayers would not have to continue to pay for abortions. Under this bill, any individual who does not have a plan that meets the minimum benefit standards will be forced to pay an additional 2.5% tax penalty, and any employer who does not provide coverage that meets these standards will pay up to an additional 8% tax penalty. This means that Americans who do not want a plan that pays for abortion will be penalized. In addition to mandating coverage for abortion, this bill will provide massive subsidies for abortion. It will both authorize and appropriate funding for premium subsidies. And without explicit language to clarify that taxpayer dollars cannot and should not fund abortion, massive subsidies for premiums and cost sharings will be used to pay for abortions against the moral objections of millions of pro-life Americans. The issue here is simple. Americans should not be forced to have their tax dollars subsidize abortion, nor should they be forced to be unwitting participants as the abortion industry uses this law to mainstream the destruction of human life into Americans' health care industry. Health care is about saving and nurturing life, not about taking life. Abortion is not health care. The majority of Americans do not support public funding of abortion and should not have abortion coverage forcibly thrust upon them. Thank you, and I yield back.
Thank you very much.